Good morning. I'm Jane King, and I'm an AARP Virginia volunteer community ambassador from Alexandria, Virginia. Thank you for joining us today, and welcome to this discussion about the 2022 Virginia General Assembly session. Today you will hear from David DiBiase, AARP Advocacy Director, before we hear from our very distinguished guest, Senator George Barker. If you'd like to ask Senator Barker or David a question at any time during this forum, please type your question into the question and answer box at the bottom of your screen. We will take as many questions as possible as our time together allows. Thank you again for joining us. And now I will turn the program over to David DiBiase.
Thank you, Jane. I'm happy to be here for this conversation about the 2022 General Assembly session, which featured a debate on a wide variety of important issues. And of course, AARP was there, as we are in all years, with our staff and volunteers teaming up to fight for priorities that are important to people ages 50 and their ages 50 and over and their families. And we worked on legislation to help rein in the skyrocketing costs of prescription drugs. We worked on issues to increase the safety and quality of nursing homes for our state's most vulnerable residents. And we fought for family caregivers to provide them a tax credit for out-of-pocket expenses costs that they spent out of pocket for their loved ones. And we're lucky to have with us Senator Barker. He's been a champion on many issues. We've worked with him over the years. We're especially appreciative of his leadership on the nursing home issue. We'll hear more about that as we get into it. I first want to introduce him. He was first elected to the Virginia Senate in 2007. And prior to his election, he had been active in numerous civic and community organizations. Senator Barker has 2 degrees, both from Harvard University. He received an undergraduate degree in economics and public health and a master's in health policy and management. And for 3 decades, he worked for the Health Systems Agency of Northern Virginia, seeking to contain skyrocketing healthcare costs and to promote quality of care and to ensure that families in Virginia have access to medical care. He is currently a consultant on healthcare issues. He has chaired several state, county, and regional organizations relative to healthcare issues, human resources, and transportation issues. Senator Barker and his wife Jane reside in Clifton. They have 2 grown children and were foster parents of 13 children, hopefully not all at the same time. Senator Barker, you have a challenging resume. Thank you for being with us. I turn it over to you for opening remarks. Oh, you're on mute.
Thank you very much, David, and for the presentation there. I want to glad to be able to provide some information to people today on where we are on some of these issues, and then be able to answer questions and talk about what we might be able to do in the future to get things moving in the right direction. In some cases they are, but in other cases, we still have some challenges at this time. I think, clearly one of the biggest issues that we tackled this year was the nursing home staffing standards. And I wanted just to basically say, don't give up hope on it. There were a lot of things that sort of the development of the consideration of things in 2021 and then going into the 2022 session, unfortunately did not help us in terms of being able to present a full proposal on things and to have people understand it enough to be able to get it moving forward. But I'm optimistic that we can do that next year in the 2023 session. One of the things we often do with the legislature is when there are significant issues and where people are not necessarily, many of the legislators are not fully familiar with how things operate. We often do studies of those during the part of the year that we're not in session. So that means usually between April and December to be able to work on issues. I've been on the Joint Commission on Healthcare ever since I got elected, and was vice chair of it last year, and this year I'm chair of the commission. Last year, one of the issues we tackled, we had three major issues, and one of the issues was the nursing home staffing standards. We had tremendous support from the staff of the Joint Commission on Healthcare. There are about 4 people that work extensively on these issues, but the process was not as conducive last year, and we've changed it this year to be able to hopefully not repeat some of the issues we had last year. Last year, what we had was we divided the Joint Commission on Healthcare into 3 different subcommittees, and each of those subcommittees tackled one issue. I was on the one that I asked to be on it to deal with the nursing home staffing standards issue. So we had a lot that we could have tried to an opportunity. We had tremendous information, but the problem that we had as it related to this situation was that meant that the other 2/3 of the members of the Joint Commission on Healthcare had very little knowledge of it during the year. What it meant was that there were 1/3 of the members of the commission that were pretty knowledgeable on it, and we by and large supported it pretty extensively. But the other 2/3, they voted for it, but it was basically just relying on us, and they did not have as much knowledge about it, and were not able to be able to argue more effectively for it when it came up in the legislature. So then we did come up with a bill. The previous year, Senator Kiggins from the Virginia Beach area had put a bill in, and what we did, that was what had led to the study then. I thought that she might want to put the bill in again, but she asked me to put the bill in because she figured I, being more experienced, she just was in her first term, would be more effective. And also I'm, was vice chair of the Joint Commission, and chaired one of the subcommittees of the Education and Health Committee, and worked on a lot of other major things. So the 2 of us sort of teamed up on that. I was the patron of the bill, and she was the co-patron. We've had a strategy that normally would have worked, because I was going to wait till we had the members of basically the bill had been referred to a subcommittee, because that's the normal process. But it actually never got referred to a subcommittee, and I chair one of the 2 health subcommittees. So it either would have been my subcommittee or another one that I sit on, but I'm not chair of the second one. And I think if we had had the opportunity to give a full airing of it there, it's almost certain, I'm almost certain that we would have gotten it out of not only the subcommittee, but the full committee for consideration there. What happened was at the end of the session, the chair determined we had information that put her in a position where she did not refer the bill to a subcommittee, did not even identify that the bill was going to be considered at the full committee at a last meeting for handling that. And that meeting started at 8 a.m., went till about 11:45, which we usually have to break by then to get to the floor session by noon. And so I got called on to present it at about 11:42 a.m. So almost no time whatsoever at the very end of the day when people were getting up and leaving the committee meeting. So there were a lot of things that really presented barriers and put us in a position where we were unable to be able to fully explain it and to be able to provide the justification that I think would have led to approving it. So that's it was a frustrating experience, but we learned from it, and hopefully next year we'll be better. We'll have better luck in terms of having it make sure that it is referred to a subcommittee and to be able to get it through the full committee and onto the floor and hopefully pass there. I'm pretty confident we can do that. We had great information, and we just need to be able to get that information in the hands of the other legislators, and some of them were not sure whether or not to support it and voted against it because they didn't feel they had comfortable enough to be able to deal with the issue there. So I'll stop at that point and then see what kind of questions you have and what types of issues you want to raise on things there. So.
Okay. Well, thank you for that history and process of the bill and what happens to it sometimes. We'll go to our audience for questions. So let me remind folks, if they have a question for Senator Barker or myself, that you can type your question into the Q&A box at the bottom of the screen, and we'll take as many questions as our time together allows. But we did want to start out with just a survey of you as an audience. You'll see a question come up on your screen. It should say, do you currently have a loved one in a nursing home, yes or no? And I'd say like within the last year, if you've had a loved one in the nursing home within the last year, give us a yes or a no. So it looks like somewhere between 15 to 20% of you. That's relatively high, right? There's only about 1% of the population is in a nursing home. So those on this call are, 20 times more likely to have a loved one in a nursing home. Let's go to the next poll question, which will pop up on your screen. And it's, if you have visited a nursing home, I'd say ever, in the last 20 years, did you find the care was great? And if you had a loved one there, you'd feel comfortable leaving them there? Was it okay? Was it awful, or none of the above? So pick the answer that best suits you, and we'll see what kind of turnout we have. I believe you're looking at the answers as well as I am, but if not, I'll let you know what we see. It looks like about 20% say the care was great. They felt comfortable leaving a loved one there. About half said it was okay. They wouldn't want to be there themselves. And 25% said it was awful, and they worried about leaving a loved one there. Just 6% of you said you didn't know. So, with some saying it was okay and some saying it was awful, that's 75% of you saying it was awful or okay, 25% of you saying it was awful. There really should be, hopefully, no one saying it was awful. There's a lot of systems in place to make sure that doesn't happen. So we'll move on to the next question, and that is, do you think staffing needs to be increased at nursing homes? And that's a simple yes or no choice, or you have no idea. Do you think staffing needs to be increased? Well, the overwhelming majority, about 85 to 90% of you say yes. Nobody said no, and 15% aren't sure. So that sounds about right. It is an overwhelming majority of people that think that staffing needs to be increased. And there are studies to show that if you have increased staffing, you have less issues like urinary tract infections and bed sores and dehydration and hospitalizations that are preventable and that kind of thing. So there's a great association between staffing and good care. All right, it's my turn, my opportunity now to go to the Q&A. Let me see how smoothly I can do this. While I'm looking at the Q&A, Senator Barker, could you share a few things that you think the General Assembly could do other than just increasing staffing that would help nursing homes? I should say increasing the staffing standard. If you want to talk a little bit about what increasing the staffing standard means, it's a little different than just the workforce issue. If you want to talk a little bit about both of those, I'll see what we got for questions in the Q&A.
Sure. One of the things that we did when we were meeting in the Joint Commission on Healthcare and came up with a recommendation for the staffing standard. We don't really have a direct staffing standard other than just a few minimal things related to having a registered nurse in the facility, those types of things. But there's not extensive levels of staff that are required at any point. What we did was we relied upon what the federal government does through the Center for Medicare and Medicaid Services. They do quarterly evaluations of the needs of the residents of the nursing homes all across the country that are participating in either Medicare or Medicaid. And that's nearly all of the facilities in the country. Well over 95% of the facilities do have provision of either Medicare or Medicaid services within their nursing homes, and they're certified for that. And what they do is they evaluate the needs of the patients that are in each of those based upon what a lot of research has shown in terms of what the what the need, how much nursing care and et cetera that they would need. and then they compare that to the staff that they have operating in those facilities. In Virginia, the information that we got was that a little over 20% of the nursing homes are less than the minimal staffing, what the federal government says the minimal staffing level should be. And that's based upon not just one standard, it's based upon the needs of the patients that are in the nursing homes. So it's a flexible thing that is relevant across the board there. And that's what we wanted to have adopted as part of that situation, the standards that we would have. What we also have done, however, is we have provided additional funds to the nursing homes. We did some of that during the COVID period over the last couple of years with some funds from the CARES Act, which was at the federal level, and some from the AARP program, which has been in place for a little over a year, almost a year and a half now. Those have helped them. The other thing that we've done is for the first time, have really tried to link increases in pay for nursing homes who are using it in productive ways. And so we have now adopted a program and put a fair amount of money into it in the budget. And I was one of the 3 people who put together the state budget. So I made sure that this was in there. And it is linked to what they do in terms of staffing and other types of care that they are providing to the people. So it's relevant to that. It's not just an across the board that everybody gets, whether or not you do anything constructive with it. So we actually are making some progress on that. And I think that does provide us some opportunity to be able to get good staffing standards implemented, hopefully starting next year sometime.
Thank you. So in case you answered this question, I'll apologize, but we have a question. Do you anticipate introducing a nursing home staffing bill this year, and would it be based on hours per day per patient?
Yes, I do anticipate putting the bill back in again. And, I think we'll be able to be much more successful next year because hopefully we'll get a full airing of it rather than just about a 3 to 5 minute presentation that this doesn't do the issue justice. It's not what we have proposed has not been just a single staffing standard saying every nursing home has to be this level, regardless of whether they have a lot of patients who are very complex and have great needs, or have a lot of patients who are not as needy in terms of the care that they would be getting. And there are clearly wide ranges of the needs of the patients who are in different facilities. And they also can evolve over time. And what we want to do is make sure that if the need of the patients goes up, the staffing standard would go up. If the need of the patients in that facility go down, the staffing standard would go down. So you don't have more people than necessarily the minimum, at least the minimum you would need if the nursing home chooses to operate that way. But we would be taking care of the needs of all the patients adequately.
Okay. Yeah, I'd like to add a little to that. The Centers for Medicaid and Medicare Services, which, Medicaid pays for, I think, 66% of all nursing home stays. So the federal government has a big say in how things are done. They did a study in 2000 where they said you needed 4.1 hours per day per resident. And those 4.1 hours were a combination of nursing RNs or LPNs and then certified nursing assistants. The majority of that time was by certified nursing assistants. But that's an outdated number, 4.1. Some people think now it should be about 5.4 hours per day per resident. And at the 4.1 standard, 78% of our facilities would fail. They don't have 4.1. So I just want to show that, we really are, as a state, failing. And your discussion about, the greater the needs of the resident, then the greater the needs for staffing. One of the ways that you base how much need, by the way, I'm an RN who worked in a nursing home. One of the ways you base how many needs a patient has is how many activities of daily living can they do on their own. So can they bathe themselves? Can they toilet themselves? Can they feed themselves? Can they transfer from a bed to a chair and back by themselves? And Virginia has a pretty high standard. You can't get in a nursing home without having 2 ADLs, 2 activities of daily living that you can't do independently. That's a high bar. A lot of states allow folks into a nursing home to be paid for by Medicaid with just one ADL. So we kind of have a high acuity to begin with,
Right.
you know, we're like 46th or something in the nation for our staffing standards. So I just want to paint the picture that, you know, raising it any would be a good thing, and we appreciate your leadership on that. I see us in kind of dire straits, so I wanted to paint a little darker picture of why the need is so urgent. Let's go to, if you have a comment on that, great. I'll look for the next question.
Yeah, I mean, clearly, I think you know, we have a ways to go, and you are correct that we have one of the highest levels of thresholds if you're going to be a Medicaid patient in a facility, in a nursing home. And so, and as a result, we actually have, if you compare our nursing home population to the total population 65 and older, we're, last I saw, the most recent data I'd seen was that we were lowest in the entire country. So we don't have a lot of people in nursing homes. We do have a lot of people in many instances in assisted living facilities. And I think that one of the things that we're trying to do this year is start the process of doing significant evaluations of the assisted living facilities in Virginia, because they've sort of been out there on their own, and in many instances has the same type or people who are in similar situations as many of the nursing home patients. And there are all kinds of issues there that we don't adequately fund. We're low in terms of what we pay for Medicaid for nursing homes, but we're even much worse in terms of what we pay for assisted living facilities. And we need to continue to address it. I did get a significant increase in funding last year for the assisted living facilities, but that only took them to about 40% of what it cost there. So we still have a long ways to go.
Thank you for that. Yeah, I made a comment earlier about the population of nursing home residents. We have like 8.6 million people in Virginia. We have about 30,000 in a nursing home. So, you know, if it was 1%, if my math is right, it'd be 80,000. So it's far less than 1%. It's less than half of a percent. And I think some of the reason for that is we don't pay for nursing home stays unless you have a high acuity. So you can't get in for Medicaid. And, you know, most people can't afford a nursing home at an average of $90,000 a year. So, you know, the spend down and going on Medicaid happens when families know their loved one can get on it. Otherwise, they're going to do home care for as long as possible to try to not go bankrupt. And then, as you mentioned, assisted living facilities, they're not even regulated by the Department of Health or the Office of Licensure and Certification. They're under the Department of Social Services. So you bring up a good point that we need to look at them, and we sure will look at them next. But I think our focus is going to be on nursing homes for at least another year before we shift. But thank you for bringing up assisted living.
Yeah, I think the assisted living is a very significant issue, and we need to get that more aggressively looked at and start to move in the right direction to provide services there. And I mean, my mother-in-law was in an assisted living facility till she died earlier this year, and she was 99. And but you could see they had the same types of staffing issues, the same types of pay issues that they've had for a lot of their the aides that are there, you know, those types of things. A lot of them were great, but you know, they're challenged if there aren't enough of them there, and to be able to take care of people. And we need to make sure that we're doing that. And it actually costs more than $90,000 a year for my mother-in-law to be in that assisted living facility, and so we were just having to pay out of her resources.
Yeah, no doubt. Being in Northern Virginia, you always skew higher for cost of everything.
Yes. Yeah.
Sure, and significantly so. Our next question is, what kind of impact or influence does the nursing home industry have on members of the General Assembly?
Well, they are not by far the most aggressive and effective lobbyists there, but they are there, and we all have nursing homes in our districts or very near our districts, so that you know, people are responsive on it. And I mean, part of the challenge we had this year was because I had not had time to be able to talk to other legislators substantially on it. before the bill was detoured around the subcommittees and then presented at a full committee meeting when no one knew it was coming up, including Senator Kiggins, who had been the earlier initiator on this. It was hard to be able to go up against the nursing homes on that. And the nursing homes got a little bit of the benefit of the doubt on things, on what was being considered and what I had said. But we'll be able to take that on much more next year. And I think as long as we have a lot of advocates pushing for it, we got a good chance.
Thank you. One of the questions was, who is a member of the Joint Commission on Healthcare? And I will just say, I'm looking at it right now. There are 7 senators, 2, 4, 6, 8. It looks like 10 delegates. Obviously, you're the vice chair. Delegate Patrick Hope is the chair. And as you mentioned, there's 5 or 6 staff members. So I won't go through all the names. It's a mix of both delegates and senators, and there's both parties are represented equally.
Yeah, there are 10 delegates and 8 senators who are on it. We want to make sure that the legislators have the ability to get the information so that they hopefully, when we go to the General Assembly, the full assembly, that the members of the Joint Commission can be effective in advocating for it. And it was just the process that we had on the Joint Commission last year, which I've gotten straightened out this year now that I'm chair of the Joint Commission. Last year I was vice chair. So I think we're in good shape moving forward on it. And there is the Secretary of Health and Human Resources is a non-voting ex officio member of the Joint Commission as well, to get the administration at least understanding the issues that we're looking at.
Okay. Shifting a little bit here, someone has a question about the desire to have advisory commissions hold virtual meetings. If that came up in legislation, would you be a supporter? I'm not sure what they mean by advisory commissions, but you can interpret the question as you see fit. Do you think virtual meetings should be mandated?
Well, they're not mandated, but there's the opportunity, and we did have legislation that was passed this year, which will go into effect on Friday, since Friday will be July 1st, to allow for continuation of what had been virtual meetings operated by commissions on aging, those types of things, to be able to operate that way. We did not allow local government bodies, such as boards of supervisors, city councils, town councils, those types of things, to be able to operate there, because we felt that the offices, when you're electing someone, you need to have the ability to be able to go there because they're making real decisions. Whereas often these advisory commissions are just making recommendations to the city council or to the board of supervisors.
Thank you. Can you talk a little bit about value-based purchasing, the initiative that went through? I know there was a budget amendment about it. This is for nursing homes. What effect would it have or could it have on the quality of care?
I think will have a very significant effect on the quality of care because there are, I think it's about 7 different factors that are built into it. 2 of them specifically relate to staffing. Others relate to a provision of other services that are there. And if they provide more staff and provide more services to the residents there, then those are the ones that will get additional funding. So it's not an across the board type of thing. You have to, in effect, earn it. So it's the first time we really had this type of process set up there. And the Department of Medicaid and the nursing homes have themselves worked on it extensively and collaboratively, so that we believe from an effective standpoint that it's very good, and the nursing homes are supportive of it and are looking forward to being able to, in effect, provide the services, provide the staff, and get paid more for it.
I have understood that it's the poorest performing nursing homes that would struggle the most under value-based purchasing. Is there any thoughts about that? That you get rewarded for good behavior, and if you're always having bad behavior, you never get the rewards, which is fun.
Yes. And you are correct, and that is the case. And so what this will do is this will reward those nursing homes who are doing what we want them to do. It will penalize those nursing homes, not necessarily taking anything away from them at this point, but it will penalize them and that they will not get the same level of increase if they're not doing what we want them to do.
So if I can have a comment on that, my thought is, if it was a highly functional system, I think value-based purchasing would work because everyone would have equal access to the reward. But if it's a dysfunctional system, which I do believe it is, then the lower performers aren't set up to succeed, and so they're going to continue to fail. And one of the issues that we have seen is that the poor nursing homes are primarily Medicaid patients. And a lot of the nursing homes that are the poorest performers are the residents have a higher percentage of being African American, Black. So there seems to be some systemic racism that trickles into nursing homes. And I just wondered if there's been any discussion about the racism that happens in nursing homes and how you raise up low performers that have been neglected.
Well, the situation is really, I think, is more extensively based upon where the facility is and what market it's tapping into. And most of it is based upon whether or not the patient is Medicaid. So if the facilities that have major issues, by and large, in terms of quality of care and those types of things, by and large, are those that are where 95% of their patients are Medicaid patients. Because then they don't have opportunity to be able to earn a profit that will allow them to invest that in staffing or in the operation of the facility in a positive way. So that's where you really run into issues. The other thing is that if nursing homes are not operating well, generally what starts to happen is as long as there's another nursing home that's in that is competitive in that area, you will end up with one nursing home at 95% of the beds filled and another at 75% of the beds filled. And obviously, if you're the one at 75%, you're more likely to struggle financially and not provide the services that you need. And so it becomes a real incentive to get them to be able to do that. During the COVID, since we had COVID starting back in March of 2020, occupancy rates in nursing homes have decreased dramatically. It used to be that you wouldn't get full payment from Medicaid unless you were 95% of your beds were filled. Then it gradually was worked down to about 90%. But now they've sort of put a lot of that on hold because of the high vacancy rates that have a lot of facilities that are 65, 70, 75% of their beds are filled. And that's creating some significant problems. And that's despite the fact that we have no more, basically we have the same number of nursing home beds in Virginia now that we had 25, 35, 30, 35 years ago. You go back to there was a number of facilities that were built in the 1980s, but there have been almost no significant bed increases since 1987 and 1988. That's the last time there were very many nursing home beds approved. So we don't, there's not a lot of beds, despite the fact that the 65 and older population has dramatically increased since then, which works both positively and negatively. So.
Yeah, that's fascinating that we haven't created more beds, but I think the shift has been to home care. There was a time when Medicaid was only for institutional care. You couldn't get Medicaid dollars if you weren't in an institution. And with our 1915 waiver, we're able to shift funds to home and community-based care. And in my time, I think maybe 4 or 5 years ago, Virginia finally tipped the scale where we were equally spending funds in home care as we were in institutional care. And I think now the majority of funds, not by much, maybe 52% or something, is spent of Medicaid dollars is spent on home care. And that's where people want to be, right? People want to age at home. Even if it's not the best place for them to be, people just don't want to leave their homes.
Right.
So I think that's another, frontier to look into, is making sure that as people age at home, they're getting the services they need. So there's a there's a lot for AARP to be working on in the coming years. We're certainly not going to be lacking an agenda. On the nursing home.
The other thing that's happened significantly over the last 35 years, when the nursing home beds have not increased, assisted living beds have dramatically increased in many parts of the state, particularly the more urban areas, but even some places in the rural areas. So that there are, and that's sort of replaced a lot of the nursing home beds. So that if you have someone who has the funds to be able to pay for it, because there is no Medicaid coverage, and the auxiliary grant program, which provides for some low-income people in assisted living, is abysmal. So, basically most assisted living facilities don't take those auxiliary grant patients. But what we end up with there is that the same person who would have been in a nursing home 25 years ago, 35 years ago, now is in an assisted living facility.
Yeah, kind of, sort of. But I mean, you can't be in an assisted living facility if you have activities of daily living that you can't do. You have to be, pretty independent. That's the distinction, right, between assisted living, and that's why they're not regulated by healthcare, because they're supposed to be able to give themselves their own meds. You don't need to have a nurse, or a nurse's aide delivering medications at an assisted living facility. If you have that, it's like a concierge service. It's not a must.
Actually, in the assisted living facilities now, you do have to have a nurse or a nurse's aide that's been trained to deliver the medication. So there are a lot of requirements that are actually the same as what you have to have in terms of how you operate in a nursing home. So what's happened is that a lot of people who would have been in a nursing home now are in assisted living.
All right, I stand corrected on that. I thought there was a hard line, and that's why social services had them.
Yeah, when my mother-in-law went from being in an independent living unit to being in the assisted living unit, she was no longer able to have any of her medications, period.
Interesting.
They had to be given by a staff person who was trained.
Very good. Good to know. Thank you. We are rounding our time out. I think we could probably take one or two questions that are simple. Let me see if I can find a yes or no question. We could shift to a general question about the budget, and then we can go to any closing remarks you have. The general question about the budget was, is there anything that occurred that you are, the word is mournful of having lost? Is there anything in the budget that you wish had been in there, or any thoughts about what was gained or lost in the budget?
I think most of what we did on the side where we're dealing with AARP members and other people of that 65 and older population, although AARP can go in much before 65. So, but I think we did some positive things in there that will help us put us heading in the right direction. And some of the things that we're studying this year with the Joint Commission on Healthcare, like the assisted living facilities, I think will help get us in a position where we'll be able to move more aggressively next year in providing better services across the board there. So I think that we're overall in a pretty good situation, but we still have some challenges going forward.
A yes or no question: do you favor a tax credit for family caregivers out-of-pocket expenses?
Actually, right now, what we are mostly doing in the budget is providing funding for services where we can work through the localities, through the social service departments, through whatever operations structure is in place to be able to provide support to people there. And I think that is more where we're going rather than sort of a blanket across the board tax credit. Actually, we're going to have a joint subcommittee of the House and Senate members to look at a lot of the taxes and tax credit issues that we have this year. So we will be looking at those types of things, and there will be some consideration of it. But I think we right now are trying to make sure that we're targeting the money better rather than just having it be just a tax credit type of thing. So.
Well, thank you for that. And thank you for being a wealth of information on everything that we talked about today. You're a true leader in the healthcare realm and many other realms, but AARP certainly appreciates your leadership on the nursing home issue. I'd like to, close by showing that appreciation and giving it to you for any follow-up or closing remarks you'd like to share.
All right. Well, what I would like to say is that I'll be back next year. I'm not one of these people who puts in a bill, and if it didn't pass that year, I never to put it in again. I'm determined to get things through when I think that they are critical to what we need to do, how we need to be operating in Virginia. And so I will be coming back on that issue as well as some others, and probably some things related to assisted living as well, to get us pushing in the right direction on these services and making sure that we are adequately taking care of our older population and people who for other reasons may have significant disabilities. So I'm looking forward to it, and hope to be working with you and to be able to get a lot of advocates out there this year. So it's not just the nursing home saying something on this issue. It's the legislators hearing it from their constituents. Yeah, absolutely. On that note, if you would like to know more about AARP Virginia's work in the General Assembly, please get in touch with us. We'll put our email and our phone number in the chat. If you signed up for this by email, then you'll be getting a reply after this meeting's over with our phone number, our email address, and further information about the nursing home industry. We'll also place that information, our email, our phone number. If you're on Facebook, we'll put it in the comment section. So if you are interested in being an AARP volunteer and advocate, we'd love to hear from you. If you have family or friends that have stories to share about this issue affecting you, we'd love to hear from you. Those stories are really important to have in front of legislators. You really don't want people like me talking to them. You want people like you, those who have had direct experience with it and can say, this is what happened and this is what we need. This affected my family. Please make the right decisions to protect our seniors. And I want to thank again, Senator Barker for his leadership, and thank you all for participating. Thanks for your questions. I hope you can be a part of our 2023 efforts and have a wonderful remainder of the day. Thank you all.